Estrogen replacement therapy has been long prescribed for side effects of menopause. What's not frequently talked about is the effects of estrogen on your vaginal pH, which places you at a higher risk for bacterial vaginosis. Estrogen is known to work as a protective factor or a protective hormone. When the normal vaginal pH begins to climb, there's a strain of bacteria that takes over the vaginal tract. This is what places the woman at risk for developing bacterial vaginosis, or BV. BV is characterized by a strong fishy odor. You may also have a thin, white, or grayish vaginal discharge. Pain, burning, and itching may also be a side effect. If you think low estrogen is the cause of your BV symptoms and you've been considering estrogen replacement therapy, give your provider a call, schedule an appointment, and let them know you want to come in to discuss your options. Using pH strips is a wonderful and inexpensive tool. I recommend testing your vaginal pH at home. The brand that I use is by Natureland, and I buy them from Amazon. There are other brands available which you may be able to also find at a local pharmacy, perhaps a Target or Walmart. And again, the brand that I use is by Natureland and off of Amazon, and this is what it looks like. Using the pH test strips is a wonderful and inexpensive tool to help you possibly rule out infection. If you test your vaginal pH and your pH turns out to be normal, it's possible you don't have BV. Nonetheless, if you're having any symptoms of an infection, give your practitioner a call to get tested.